Hi, I'm Sandy Munden. I'm the CFO with Community Health Center Association, and with me is Catherine Gilpin with Forvis Mavis. We want to ask you a few questions about what your impression is on the future of health centers, and what do you see as the opportunities or challenges that we have to address today to ensure stronger, healthier communities tomorrow?
Well, Sandy, I think that's a great question. And one of the things as a partner at a public accounting firm that I think is really important, and one of the things I was just talking about with the members of the association today, was really thinking about financial health, right? So all health centers are coming out of a post-COVID situation where we've had a lot of stimulus grant funding, and that one-time funding has gone away. And what we're looking at right now is operating results that aren't making it so that when I look at performance, we're going to have, it looks like our future financial health is going to be sustainable. One of the things I think to make sure that as we prepare, we want healthy communities tomorrow, which means we need to be a financially healthy organization. And so we need to be thinking about how is my health center doing? And we know there's a lot going on in the environment right now, right?
Right.
We know that we're right before the September 30th deadline. Our federal government has approved a budget. We don't know about there's a lot of things that we don't understand and we don't know about right now. But what I do know is that running a health center isn't going to change regardless of anything that relates to our budget or the way Medicaid changes and different things like that. So I would just challenge health center leadership teams from a business perspective to challenge their operations now to make sure that they are running a good health center. Their business of the health center is very healthy, so that we can be organizations that are able to and exist to provide services to our communities moving forward so that we can keep them healthy. We really need to keep finances top of mind to make sure that we can continue to expand the services we provide rewarding employment opportunities to our team members, right? And serve our community.
Right.
I think that's critically important.
When you've been here at this conference, what are you seeing from the health centers? Are they presenting you with where their challenges lie? Do you see that?
So we do see a lot of health center challenges. One of the things I encourage everybody to understand, right, is we're going to have a challenge. And as I move forward, knowing that the challenge isn't going away, it's like, if this is what the reality of where we have to operate, what can I do because I don't have any other choice to respond? Proactively plan and strategize for the future. Don't think about don't be a victim, right? Proactively work to understand the risks your health center is facing and think about different ways you can plan to mitigate those risks, and then potentially put your health center in a stronger position to move forward in.
Has this conference helped you build connections with other health professionals and organizations?
Absolutely. One of the biggest values that I see in any conference is connecting with people that are working at health centers on the front lines and understanding their challenges, right? Because there are questions that I get asked all the time, and I'm like, darn it, I wish I had thought about how that would impact other health centers, because I have had the pleasure of serving health centers and working with them for the last 15 years, and I love engaging with all of the health centers that are attending this conference, because I learn at the same time, and then it helps me to help other people navigate what every single one of us are going through. So those are the biggest benefits to me of attending at this conference. Is I love that engagement, and I love having conversations with everybody that's on the front lines and understanding what they're dealing with, so I can understand it and help others.
Well, we look forward to you coming every year. I think I know everything, and I always learn something that I didn't know. So I'm hoping the other attendees have done the same. But yeah, we're very glad you were here. Thank you for sitting with us and giving us your perspective on the future of health centers.
Yeah, absolutely. Thank you for having me.